If you're on Medicare or about to turn 65, what Congress just passed on July 1st is going to hit your wallet hard. I'm talking about prescription drugs getting more expensive, doctors potentially harder to find, and if you're a legal immigrant, you might lose Medicare entirely. This is the Medicare earthquake of 2025, and nobody's talking about it. Hey everyone, this is Xactinsure, and I need to tell you about the Medicare bombshell hidden in the One Big Beautiful bill that just passed the Senate. While everyone was focused on the AC and Medicaid cuts, Congress quietly made changes to Medicare that are going to cost seniors billions of dollars. And the worst part? Most Medicare recipients have no idea this is coming. Let me start with the big one, prescription drug prices. You know how Medicare finally started negotiating with drug companies to make your medications more affordable? Remember when insulin got capped at $35 a month? Well, Congress just blew a massive hole in that program. They expanded what's called the Orphan drug exemption. Here's what this means in plain English. If a drug company says their medication treats a rare disease, Medicare can't negotiate the price. Under the old rules, this made sense for truly rare conditions. But Congress just changed the rules so that if a drug treats multiple rare diseases, it's also exempt from price negotiation. This sounds technical, but here's the real-world impact. Let's say you take a medication that costs $3,000 a month. Under the old negotiation program, Medicare might have gotten that down to $1,500 a month, saving you hundreds in copays. Under the new rules, if that drug company can find just one additional rare disease use for their medication, boom, no price negotiation allowed? Your $3,000 medication stays at $3,000. The Congressional Budget Office says this change alone will cost Medicare beneficiaries an extra $4.9 billion over the next 10 years. That's $4.9 billion that could have been savings for seniors, instead going straight to pharmaceutical company profits. And here's the cynical part. Drug companies are already scrambling to find additional rare disease applications for their most expensive medications just to get them exempted. It's like they created a get-out-of-jail-free card for Big Pharma. But wait, there's more. If you're a legal immigrant on Medicare, this gets really scary. Congress just banned certain legal immigrants from Medicare enrollment. We're talking about refugees who fled war zones, asylum seekers escaping persecution, survivors of human trafficking and domestic violence. These are people who came to America legally, many of whom have been working and paying into Medicare for decades. But now, when they turn 65, they can't get Medicare benefits they've been paying for their entire working lives. Think about this. Imagine you're a refugee who escaped a civil war, came to America legally, worked in a factory for 30 years paying Medicare taxes. And when you turn 65 and need health care the most, the government says, sorry, you can't have the Medicare benefits you paid for. That's exactly what just happened. Now, there is some good news. Medicare doctors are getting a 2.5% payment increase in 2026. This matters because Medicare typically pays doctors less than private insurance, and many doctors have been limiting how many Medicare patients they'll see. So this increase should make it easier for you to find doctors who accept Medicare. But here's the catch. This is only a one-year fix. The House wanted to make permanent inflation adjustments to doctor payments. The Senate said no. So we're back to the same problem in 2027. There's also a special deal for Alaska and Hawaii. Medicare payments to hospitals in those states are getting increased to account for higher costs. But if you live in the other 48 states, this doesn't help you at all. Here's what really gets me fired up about all this. While Congress was cutting prescription drug negotiation and kicking legal immigrants off Medicare, they created a $25 billion rural health transformation program. Sounds great for seniors in rural areas, right? Wrong. This money isn't automatic. States have to apply for it, and one person gets to decide who gets funding. Dr. Oz, the TV doctor who used to sell miracle weight loss pills. That's right. The same guy who got in trouble for promoting questionable health products on television now has sole discretion over $25 billion in healthcare funding. And the law specifically says there's no appeals process. His decision is final. So let me get this straight. We're making prescription drugs more expensive for seniors. We're kicking legal immigrants off Medicare, but we're giving a TV personality $25 billion to hand out however he wants? This isn't healthcare policy. This is a political game. And seniors are the pawns. Here's what you need to do right now if you're on Medicare. First, if you take any expensive medications, especially for rare conditions, start researching Medicare Part D plans for 2026. You might need to switch plans to get better coverage because your current medications might not be subject to price negotiations anymore. Second, if you're a legal immigrant on Medicare, you need to understand exactly how these new restrictions affect your status. Don't wait until you get a notice in the mail. Third, if you're approaching 65 and planning to enroll in Medicare, make sure you understand these new rules before you sign up. And here's the timeline that should scare everyone. Most of these changes take effect January 1st, 2026. That's less than 6 months away. The Medicare open enrollment period for 2026 starts October 15th. That means you have less than 4 months to figure out how these changes affect your coverage and costs. The drug pricing changes are particularly sneaky because you won't see the full impact until 2027 and 2028, when medications that should have been subject to price negotiation are exempted. By then, drug companies will have had time to get their most expensive medications classified as multi-orphan drugs, and your costs will start going up. This is exactly why Xactinsure exists. We're launching a Medicare Defense Initiative specifically to help seniors navigate these changes. We're going to monitor which medications get exempted from price negotiation, help you find the best Part D plans for 2026, and make sure you understand exactly how these changes affect your coverage and costs. If you need help, our contact information is in the description below, and we're offering free consultations through the end of the year. Look, I know this is frustrating. I know it feels like the system is rigged against seniors. But here's the thing. Knowledge is power. If you're watching this video, you're already ahead of 95% of Medicare beneficiaries who have no idea these changes are coming. Share this video with your friends, your family, anyone you know on Medicare. They need to know what's coming so they can protect themselves. The bottom line is this. Congress just made Medicare more expensive and less accessible while handing billions of dollars to pharmaceutical companies and giving a TV personality control over rural health funding. But we're not going to let them blindside you. We're going to fight for every dollar of benefits you've earned, and we're going to make sure you have the information you need to navigate these changes. Subscribe for more updates on how to protect your Medicare benefits, and we'll see you next week.